Introduction. Arthritis is characterized by joint inflammation and stiffness. This disease is chronic and can afflict persons of any age or gender, although it is more common in the elderly. Pain, swelling, and decreased mobility in affected joints are just some of the ways in which arthritis can negatively influence a person's quality of life. Several distinct forms of arthritis exist, each with its own symptoms and causes. Osteoarthritis, rheumatoid arthritis, and psoriatic arthritis are the most prevalent forms. The most common kind of arthritis is osteoarthritis, which develops when the cartilage that cushions the ends of bones and joints deteriorates. Children can also suffer from juvenile idiopathic arthritis and reactive arthritis. Arthritis affects people of both sexes, but there has been a recent push to focus on how it manifests majorly for women. The fact that women experience a unique set of difficulties in dealing with this long-term illness has led to this emphasis. Certain forms of arthritis are more common in women. For example, women are approximately 3 times as likely as males to develop rheumatoid arthritis. Researchers and medical professionals have been motivated to investigate the causes of the gender gap in this form of arthritis because it is more common in women. Women with arthritis tend to have a very different experience than men due to hormonal considerations. Arthritis symptoms may be affected by the hormonal shifts that occur throughout a woman's reproductive life, including those that occur during menstruation, pregnancy, and menopause. Some women have a worsening of rheumatoid arthritis throughout their menstrual cycle, while others have flare-ups during pregnancy or after giving birth. Changes in hormone levels can have an effect on the immune system and joint inflammation, necessitating individualized approaches to symptom management. Women may find it difficult to manage their arthritis symptoms while juggling the many activities and responsibilities they are expected to fulfill. Their mental and emotional health, as well as their quality of life, will suffer as a result. In this book, we will be delving in depth into all you need to know about arthritis in women, from symptoms and causes to detailed solutions on managing arthritis. Chapter 1. A brief introduction to arthritis in women. Women are more likely than men to suffer from arthritis. Cartilage, a protective substance that cushions the joints, breaks down gradually as women age due to cumulative wear and tear. Osteoarthritis, the most prevalent type of arthritis, can develop as a result of this wear and tear of the cartilage. Arthritis in women is complicated by hormonal shifts. Researchers have discovered that the female hormone estrogen can prevent joint damage. However, estrogen levels drop at menopause, making women more likely to develop arthritis later in old age. Rheumatoid arthritis is an autoimmune disorder in which the body's immune system assaults and inflames the joints. This hormone imbalance may play a role in the development of this particular form of arthritis. The likelihood of having arthritis is also greatly influenced by one's genetic makeup. A woman's risk of developing inflammatory arthritis such as rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis can be increased by her genetic makeup. The odds of getting arthritis are much higher if someone in your family has it. Women are more likely to get arthritis if they are overweight or obese. Joint deterioration and the chance of developing arthritis can be accelerated by having excess weight, especially in weight-bearing joints like the knees and hips. Infections and traumas are also potential arthritis triggers. Arthritis and other joint problems can develop after an infection of the joints, whether bacterial or viral. Injuries like fractures and ligament tears can also increase the likelihood of developing post-traumatic arthritis by causing permanent damage to the joints. Women's chance of developing arthritis might be affected by their way of living. Rheumatoid arthritis risk is raised in people who smoke cigarettes regularly. Joint stress and strain, such as that experienced while typing or working on an assembly line, can also contribute to the development of arthritis. Chronic inflammation is also another factor. Arthritis is more common among women who suffer from inflammatory diseases like lupus or psoriasis. Joint injury might develop from the chronic inflammation caused by these disorders. Also, rheumatoid arthritis has been linked to hormonal shifts seen during pregnancy. Although women are more likely to be diagnosed with arthritis, researchers still don't know why this is more common in women than men. This higher incidence has been hypothesized to result from biological, genetic, and immune system differences between men and women. However, more study is required to determine the precise roles played by each of these elements. How arthritis affects women all around the world and in the United States. Women suffer from arthritis at higher rates in the United States. Arthritis affects over 20% of American men and 26% of American women. According to the Centers for Disease Control and Prevention, women's arthritis is not just a problem in the United States. It's a worldwide epidemic. Arthritis affects more women than males worldwide, including in both industrialized and developing countries. Women have a disproportionate share of the arthritic burden, especially in low-income countries. Women in these areas have unique difficulties because of factors such as restricted access to health care, inadequate treatment options, and low arthritis knowledge. Cultural norms and gender inequality may also prevent women with arthritis from receiving the care they need. It's important to remember that arthritis can affect people of any age. Arthritis affects women of all ages. However, it is more typically seen in the elderly. For instance, females are more likely than boys to be diagnosed with juvenile arthritis, a disorder that affects children and adolescents. Women in the United States bear a disproportionate share of the arthritis burden. Doctors diagnose arthritis in approximately 25% of all American women. Many causes, including biological, hormonal, and sociocultural ones, have contributed to this increased incidence. As age is a major risk factor for arthritis, the higher frequency in women likely results from the fact that they live longer than males on average. In Australia, women also disproportionately experience the effects of arthritis due to higher rates of prevalence among women compared to men. Arthritis affects more women than males, and this trend is mirrored in the United Kingdom. And as we have clearly noted earlier, there is no age bracket immune to the effects of arthritis in women. Despite arthritis' association with aging, it can affect women of any age. Pregnancy, menopause, and arthritis. Hormone levels, especially those of estrogen and progesterone, might fluctuate throughout pregnancy for many women. Particularly during pregnancy, estrogen levels rise, and it is well known that estrogen has anti-inflammatory effects. Some women may get relief from their arthritic symptoms at this time. However, not all pregnant women enjoy this respite, and some may even experience a worsening of their arthritis symptoms. Some women experience a rapid recurrence or worsening of their arthritis symptoms after giving birth because a dip in hormone levels occurs during this time. Women with arthritis may find it especially difficult to care for a newborn while also managing their arthritis symptoms during the postpartum period. Hormonal changes during menopause can also have an effect on arthritic symptoms. Estrogen levels drop naturally throughout menopause. Due to estrogen's anti-inflammatory characteristics, its loss may exacerbate arthritic symptoms. During menopause, arthritic symptoms in some women may intensify or become more difficult to control. Gaining weight during pregnancy increases the load on your joints, which may exacerbate your arthritis symptoms. Also contributing to joint stress is menopause-related changes in body composition, such as an increase in belly fat. It's worth noting that hormonal shifts, pregnancy, and menopause can have varying effects on arthritis symptoms. Some pregnant women may feel temporarily better, while others may experience a worsening of their symptoms. Arthritis during menopause might vary in both intensity and course from woman to woman. Arthritis treatment during these times of transition calls for individualized care. Women with arthritis can benefit from working together with their healthcare providers, such as rheumatologists, to find ways to manage their symptoms and achieve optimal joint health. Medication, physical therapy, dietary and stress management changes, and self-care practices including exercise and meditation are all possible components of treatment plans. Symptoms of arthritis. Joint stiffness is a common sign of arthritis. It's common for women to have morning or post-rest joint stiffness. There may be some relief from the stiffness as the day progresses, or with some light stretching and activity. Arthritis is characterized by inflammation, and swollen joints are a common symptom experienced by women. Joints may feel uncomfortable or appear enlarged due to swelling. The affected joints may also be tender to the touch and red in color, both of which are signs of increased blood flow and inflammation. Joint mobility impairments are another potential effect of arthritis. Reduced mobility in the affected joints might make it difficult for women to carry out routine activities or take part in sports. Arthritis can limit a person's range of motion, making it difficult for them to bend, grip objects, or walk without experiencing pain. Arthritis often causes extreme fatigue. A lack of energy and fatigue are common complaints among women and can have a negative effect on their health and daily functioning. Arthritic pain and inflammation could make this tiredness even worse. Muscle weakness around the damaged joints is another symptom of arthritis in women. Problems with basic strength-based activities like lifting or stair climbing may result from this limitation. Muscle atrophy, which can happen when you don't use your muscles, might make your joints even less functional. Arthritis can present in a wide range of symptoms and degrees of severity in different people. Some women may only have modest discomfort, while others may suffer from severe joint abnormalities and pain. It is important to seek the advice of a medical expert so that a proper diagnosis can be made and a treatment plan can be developed. Arthritis is also sometimes characterized by morning stiffness. Stiffness and pain in the joints can make it difficult to get out of bed, especially for women. This stiffness can linger for a while, making it difficult to get moving after waking up. Women may also experience tenderness in their joints. Tenderness might develop in the afflicted joints, making even light touch painful. Because of their sensitivity, wearing jewelry or putting pressure on their joints can be excruciating. Women with arthritis, especially rheumatoid arthritis, frequently have joint swelling in the fingers. Puffy fingers from swelling can make it difficult to do things like buttoning shirts or holding small objects that need dexterity. Many women who suffer from arthritis also have loss of appetite and subsequent underweight. Arthritis sufferers may experience unexpected weight loss since their chronic inflammation has a negative impact on their mood and appetite. This can have a multiplicative effect on exhaustion and weakness. Beyond joint pain and stiffness, women with rheumatoid arthritis may experience other systemic symptoms. Joint deformity is another hallmark indication of arthritis. Deformities and alterations in structure can develop after years of inflammation and wear and tear on the joints. In rheumatoid arthritis, for instance, the joints might become misaligned or swollen and knobby, which can have an effect on both their function and their look. The mental toll of living with constant discomfort and restricted movement is real. As a result of dealing with arthritis and its effects on daily living, many women may experience feelings of irritation, anxiety, and depression. Chapter 2. Causes and Treatment of Arthritis. At the first appointment, the doctor will ask detailed questions about the patient's health, such as what symptoms they've been experiencing and how long they've had them. Because genetics can play a role in some forms of arthritis, your doctor may ask about a family history of the condition. The next step is a thorough physical examination, with special attention paid to the afflicted areas by the doctor. They will look for abnormalities in the joints and signs of inflammation such as swelling, soreness, warmth, and restricted motion. Gait analysis and other tests of physical function may be part of the assessment. The healthcare professional may order lab tests to help with the diagnosis. C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, are two markers of inflammation that can be detected with a blood test. Rheumatoid arthritis-related antibodies such as rheumatoid factor, RF, and anti-cyclic citrullonated peptide, anti-CCP, may also be tested for. X-rays, ultrasonography, or magnetic resonance imaging, MRI, may be prescribed for the purpose of visualizing the afflicted joints and determining the extent of any injury, cartilage loss, or inflammation. These imaging methods can help determine the specifics of an arthritis case. Joint aspiration or arthroscopy may be recommended by your doctor if the diagnosis is unclear or if you're experiencing unusual symptoms. Removal of a tiny amount of joint fluid for analysis is called an aspiration, and it can be used to diagnose infections. In arthroscopy, a tiny camera is put into the joint to get a direct look at how it's doing without causing any major damage. It is important to be completely open and honest with your healthcare professional during the diagnosis process. The patient should describe their symptoms in detail, including any recent changes and how it has affected their everyday lives. Working together like this aids the doctor in making a proper diagnosis and formulating a suitable treatment strategy. Arthritis can be difficult to diagnose and may necessitate a number of doctor's appointments and tests. It takes time and effort for doctors to figure out what's causing a patient's symptoms and what treatments will be most effective. If the doctor feels that the patient has arthritis or another rheumatic condition, they may schedule a second appointment with a rheumatologist. The rheumatologist will perform a more comprehensive examination, which may include specialized imaging investigations and extra laboratory testing designed to identify the exact form of arthritis that is being investigated. Certain forms of arthritis can be diagnosed in the lab, while others cannot. In the case of rheumatoid arthritis, for instance, high levels of inflammatory markers, such as rheumatoid factor, RF, and anti-CCP antibodies in the blood, can help confirm the diagnosis. Testing for specific crystals in joint fluid acquired via joint aspiration may be necessary for the diagnosis of other kinds of arthritis, such as gout or pseudo-gout. The diagnostic value of imaging investigations cannot be overstated. Damage to the joints can be seen on an X-ray in the form of osteophytes, bony outgrowths, or a narrowing of the joint space. Synovial thickening or fluid accumulation can be evaluated using ultrasound, as can inflammation in the joints and surrounding tissues. Arthritis symptoms, such as cartilage defects and soft tissue inflammation, can be detected in their earliest stages with the use of MRI imaging of the joint structures. When a rheumatologist is unsure about a diagnosis, he or she may suggest a biopsy. A tissue sample is taken from the afflicted location, usually the joint, and examined under a microscope for evidence of inflammation, infection, or other abnormalities. The healthcare provider will take the patient's entire clinical picture into account when making a diagnosis. This includes the patient's symptoms, the presence or absence of underlying medical conditions, and the outcome of any previous treatments or interventions. Once a diagnosis has been made, the doctor will sit down with the patient to go over the results and figure out the best course of action. Multiple drugs may be used to control symptoms, lessen inflammation, and decrease the disease's course. Joint mobility, muscle strength, and daily function can all be improved with the help of physical therapy and occupational therapy. Keep in mind that the path to an arthritis diagnosis may look different for different people, based on their unique set of symptoms, the suspected form of arthritis, and other considerations. Individuals can better understand the diagnostic process and obtain timely and appropriate care if they are actively involved in the process, communicate honestly with healthcare practitioners, and asking for clarification when necessary. Managing arthritis. Although arthritis currently has no known cure, there are a number of standard therapies that can help alleviate symptoms and boost quality of life. Medication, physical therapy, and adaptive equipment are frequently used in tandem to treat these conditions. Medication is an essential part of managing arthritis. Pain and swelling in the afflicted joints are typically treated with nonsteroidal anti-inflammatory medications such as ibuprofen or naproxen. To reduce inflammation and provide comfort in more serious cases, corticosteroids may be prescribed. By correcting the underlying immune system failure, disease-modifying antirheumatic medicines, DMARDs, can halt the course of rheumatoid arthritis and other forms of autoimmune arthritis. In addition to DMARDs, biologic response modifiers can be utilized to inhibit some inflammatory processes. Arthritis pain can be temporarily alleviated with the help of pain medications and analgesics. Arthritis treatment plans should also include regular sessions of physical therapy. Physical therapists create unique workout plans for each patient, taking into account their unique goals, conditions, and limits. Flexibility, strength, and range of motion at the joints are prime targets for these regimens. Manual treatments, such as joint mobilization or massage, are also part of physical therapy. Heat and cold therapy are two additional pain management and inflammation reduction techniques that can be used. Arthritis sufferers can benefit immensely from the use of assistive technology in their daily lives. These aids aim to lessen the load on one's joints, make it easier to move around, and prop one up. Orthotics, which include braces, splints, and other similar devices, are frequently used to stabilize and protect joints. Having a cane, walker, or crutches to help with balance and weight bearing can make getting around much easier. Jar openers, reach extenders, and specialized utensils are just a few examples of the adaptive items that can make life easier and less painful for those with arthritis. Lifestyle adjustments are frequently recommended for arthritis management. Reducing joint stress can be accomplished through regular exercise and a healthy diet. Symptoms may improve after adopting a healthy diet high in anti-inflammatory foods such as fruits, vegetables, whole grains, and omega-3 fatty acids. In order to avoid exhaustion and lessen the negative effects of arthritis, proper rest and stress management are crucial. There's no one-size-fits-all approach to treating arthritis because the ailment can manifest in so many different ways. Professionals like rheumatologists, physical therapists, and occupational therapists can offer individualized advice and help choose the best course of treatment for each patient. Chapter 3. Alternative approaches to treating arthritis. Conventional treatments for arthritis are limited in their effectiveness. However, complementary and alternative medicine offer other possibilities. Acupuncture is one of the most well-known of these treatments. Acupuncture is a form of traditional Chinese medicine that uses the insertion of very thin needles into particular sites on the body to promote healing and reduce pain. Acupuncture works by stimulating certain sites on the body to restore balance and stimulate the body's own healing mechanisms. Herbal medicines are another alternative treatment option that is frequently investigated for arthritis. Traditional remedies for arthritic pain and inflammation typically involve herbs and plant-based treatments. Anti-inflammatory spices like turmeric are commonly cited as examples of such remedies. Curcumin, the main component, is thought to reduce inflammation by preventing the formation of inflammatory chemicals. Ginger, another common herb, has also been studied for its possible role in alleviating joint pain and stiffness. Another method that may help alleviate arthritic symptoms is massage therapy. Applying pressure and manipulating soft tissues, such as muscles and tendons, is at the heart of this hands-on approach. Massage therapy has been shown to increase blood flow, ease muscle tension, and loosen stiff joints. Swedish massage, deep tissue massage, and myofascial release are just few of the types of massage that can be used on a person. Arthritis sufferers can also benefit from mind-body practices such as yoga and Tai Chi. These routines incorporate light physical activity, stretching, deep breathing, and lots more. Yoga and Tai Chi practiced on a regular basis have been shown to provide health benefits, including increased flexibility, greater balance, and less stress, all of which may aid in the management of arthritis. Hydrotherapy and thermotherapy are two examples of physical therapies that can be helpful. Hydrotherapy entails performing physical therapy exercises in a pool of warm water. However, heat and cold are used in thermotherapy to reduce swelling and pain. If your joints hurt, try a warm bath. While some complementary and alternative medicine practices may help, they should not be used in place of standard medical care for arthritis. It is best to talk to a doctor about whether or not these treatments are right for you and how you can best incorporate them into your unique treatment plan. Since each person's condition and response to treatment varies, it's possible that the best outcomes can be achieved through a holistic strategy that incorporates both traditional and alternative treatments. Aromatherapy is a holistic treatment that uses plant-based essential oils to improve one's mental and physiological health. Lavender, chamomile, and eucalyptus essential oils, for example, may be anti-inflammatory and analgesic. These oils, either inhaled or applied topically via massage, may help with relaxation and pain relief. There's also acupressure. It's the practice of utilizing one's fingers, hands, or specialized equipment to apply pressure to acupressure points located all over the body. Acupuncture is a form of body work that is said to aid in healing by focusing pressure on certain acupoints. Arthritis pain and discomfort can be alleviated by applying pressure to specific acupressure spots. Dietary supplements can also be used. Common supplements used for joint health and pain relief include glucosamine and chondroitin. Fish oil and flaxseed oil, both of which are rich in omega-3 fatty acids, have proven anti-inflammatory effects that may help those with arthritis. However, before using any dietary supplements, it is vital to contact with a healthcare expert to make sure they are safe and appropriate for your unique condition. Mindfulness meditation, yoga, and other mind-body practices come together in a method called mindfulness-based stress reduction, MBSR. By practicing mindfulness and acceptance of one's feelings and bodily sensations, MBSR helps its participants become more in tune with the here and now. Arthritis sufferers may find improved stress management, more effective coping strategies, and general well-being through regular use of mindfulness meditation. Biofeedback, in which people learn to control their physical functions with the help of electronic feedback, and electromagnetic field therapy, in which low-level electromagnetic fields are used to reduce pain and inflammation, are two other alternative therapies that have been investigated for the treatment of arthritis. The effectiveness of these treatments for arthritis is still being investigated. Recognizing that reactions to complementary and alternative therapies may differ from person to person is crucial. Some patients may benefit greatly from these treatments, while others may find them to be less helpful. If you want to make sure you're using these therapies correctly and safely, you should talk to a doctor or a certified practitioner who specializes in them. Chapter 4. Effects of Physical Activity and Exercise on Arthritis. When it comes to arthritis management and general joint health, regular exercise and physical activity play a crucial role. Although living with arthritis can be difficult, it is important to remember that there are many benefits to be gained from participating in healthy physical pursuits. Maintaining and enhancing joint flexibility is a major benefit of exercise for arthritis therapy. Arthritis pain and suffering can be alleviated with regular activity, which lubricates the joints and prevents stiffness. Individuals can improve their flexibility and reduce the strain on afflicted joints by participating in activities that increase joint range of motion, such as stretching or yoga. The muscles in and around your joints will get stronger as you work out, giving you more support and stability. Muscles that are both robust and flexible are better able to absorb impact, easing arthritis discomfort and delaying the disease's progression. Particularly useful for gaining muscle mass and improving joint function are strengthening exercises like weightlifting and resistance training. Regular exercise not only strengthens muscles, but also aids in keeping a healthy weight. The symptoms of arthritis are made worse, and the danger of permanent joint damage is raised when extra weight is carried around. Individuals can better manage their weight and the associated stress on their joints by participating in cardio-enhancing activities like walking, swimming, or cycling. The mental health benefits of exercise are extensively documented. As a result of physical limitations, arthritis can make even the simplest of tasks a source of emotional stress. Enjoyable physical activity has been shown to improve mood, stress levels, and quality of life in general. Joining a community or taking part in group exercise classes where you may make friends and feel supported can do wonders for your emotional well-being. It's important to note that each person's plan for exercise and physical activity must take into account his or her unique health status and physical limits. Healthcare specialists, such as rheumatologists or physical therapists, are invaluable resources for advice on appropriate exercises and the creation of individualized regimens. By taking into account any joint damage or functional restrictions, they can guarantee that activities are carried out in a safe and efficient manner. Physical activity and exercise have also been linked to long-term improvements in arthritis management. By maintaining joint integrity and preventing additional degradation, regular exercise can help reduce the progression of arthritis. By increasing blood flow to the joints, it helps cartilage and other joint structures to heal and stay in good condition. Arthritis sufferers might benefit greatly from participating in low-impact exercises like swimming and cycling. These pursuits are great for cardiovascular fitness because they don't put too much pressure on the joints. They are beneficial to cardiovascular health because they boost heart and lung efficiency, increase blood flow, and lower blood pressure. Arthritic patients greatly benefit from a strong cardiovascular system since it aids in the transportation of healing nutrients and the elimination of waste products from the affected joints. Arthritis pain can be alleviated by exercise as well. Natural painkillers called endorphins are released when we exercise. Taking part in regular physical activity can lessen the intensity of pain, making it simpler to deal with discomfort without resorting to medicine. As sleep disruptions are sometimes associated with chronic pain issues, regular exercise is especially important for people living with arthritis. The danger of falling is decreased and balance is enhanced by regular exercise. Due to decreased joint stability, people with arthritis are at increased risk for injury. Enhancing proprioception, awareness of body position, and coordination through balance-focused workouts like Tai Chi or yoga can help people avoid falls. It's worth stressing that exercise has many positive effects beyond the physical body. Consistent exercise can provide people with arthritis a sense of mastery over their condition. As a result, they will be better able to take charge of their health and participate more actively in daily life. Overcoming physical obstacles can have a significant impact on one's well-being because of the sense of accomplishment. Exercise can reduce the risk of developing heart disease, diabetes, and obesity, all of which are often coexisting with arthritis. People can improve their health and lower their risk of having certain diseases by becoming more physically active. Arthritis and weight gain. Keeping your weight in check is one of the most important things you can do to control your arthritis and lessen its symptoms. You can slow the development of arthritis and lessen its symptoms by adopting a healthy lifestyle and doing what you can to maintain a healthy weight. Here are some strategies you can follow. You should try to maintain a healthy and well-rounded diet. Eat a wide range of foods, not just one type of grain, protein, or fat. Diets high in processed foods, sugary drinks, and salt should be limited because they promote weight gain and inflammation. Choose mindful eating and limiting your portion sizes to cut back on calories. Weight loss and arthritis management both benefit from regular physical activity. Low-impact workouts such as swimming, walking, cycling, or yoga have been shown to increase range of motion in the joints, strengthen muscle, and aid in weight loss. Exercising for at least 150 minutes per week at a moderate level is recommended. It's also a good idea to work some strength training workouts into your program. Pain can be alleviated, and joint stability can be increased by strengthening the muscles around the afflicted joints. If you haven't already, make an appointment with a doctor or physical therapist so they can help you create an exercise program that's just right for you. Getting enough sleep also helps maintain a healthy weight and hormonal balance. Loss of appetite control and subsequent weight gain have both been linked to sleep deprivation. Reduce anxiety by taking deep breaths, practicing meditation, or doing something you enjoy. Dietitians and nutritionists are healthcare specialists who can help you create a personalized meal plan and manage any dietary concerns you may have in relation to arthritis. They are the best resource for overcoming food restrictions and establishing healthy new eating routines. Keeping yourself hydrated is also important for your general health and for maintaining a healthy weight. Hydration aids in digestion, metabolism, and lubrication of joints. Substitute water or herbal teas for sugary drinks if you're trying to cut back on calories. Creating a calorie deficit by eating fewer calories than you burn can be an effective weight management strategy. You can learn more about your dietary habits and the potential for weight gain by keeping a food diary and noting when and what you eat. Having this knowledge at your disposal can help you modify your diet for the better. Plan your meals around nutrients that can help reduce inflammation. Anti-inflammatory effects have been observed in the consumption of a variety of foods, including fatty fish, salmon, mackerel, nuts, seeds, olive oil, and brightly colored fruits and vegetables. You may find it easier to manage your arthritis symptoms if you incorporate these items into your diet on a regular basis. Taking nutritional supplements may help with arthritic pain and weight control. Fish oil supplements and flaxseed oil both include omega-3 fatty acids, which have anti-inflammatory qualities and may alleviate joint discomfort. To be sure supplements are safe and appropriate for you, though, it's best to talk to your doctor before you start taking them. It's important to pay attention to your body throughout exercise and adjust your routine accordingly. Consider alternate options or consult a physical therapist for advice on activities that are appropriate for your condition if you find that specific workouts or movements aggravate your joint discomfort. Water aerobics and cycling are two examples of low-impact exercises that can be easier on the joints than running. When it comes to controlling extra weight and arthritis pain, having a solid support system can make all the difference. Put yourself in a position to succeed by surrounding yourself with like-minded people. They can be there to offer support, hold you accountable, and cheer you on. You may benefit from connecting with others who are dealing with weight management and arthritis by joining a support group or a community online. It's important to keep a good attitude and show yourself some kindness as you work to control your weight. Losing weight and controlling arthritic symptoms can be difficult and fraught with potential for relapse. Try to take things slowly and applaud your successes along the way. Consider your health and well-being as a whole, not just your weight, and adopt a more holistic perspective. Always check in with your doctor to be sure these methods are appropriate for your health situation. Chapter 5. Dealing with constant aches and tiredness. The physical and mental difficulties that arthritis patients face on a daily basis can have a significant influence on their quality of life. Living with chronic pain and weariness can really make life difficult because this pain invades every crevice of your being, changing how you walk, think, and feel. Arthritis causes an unrelenting physical attack on the body. Pain, swelling, and stiffness in the joints make even the smallest movements an ordeal. Each step is a struggle, Movements that were previously effortless are now accompanied by a cacophony of groaning joints and gnawing pain, leaving the person feeling trapped in a body that would not respond to their will. When fatigue follows you around all day, it's not a pleasant guest. It slows down and discourages even the most fundamental movements of the limbs. Even the most basic activities like getting dressed or making a meal take an enormous amount of energy and stamina. A profound fatigue permeates every aspect of life, as if the very life force itself has been drained. The psychological toll of constant pain is high. It saps morale and plants the seeds of anger, melancholy, and despair. Feeling like you're constantly fighting an uphill battle with no end in sight is a common side effect of living with chronic pain. It robs one of the pleasures of life by making the individual constantly aware of their suffering and their own limits. Arthritis has severe repercussions not just physically, but also emotionally and socially. Isolation can set in as people with chronic pain and weariness give up on their usual routines and find it impossible to interact with others. As attention is diverted inward to internal concerns such as pain control and energy conservation, a feeling of disconnection from the outside world develops. The emotional toll is magnified when the irritation of falling behind on social obligations leads to self-blame. The weight of fatigue weighs down the limbs and saps the energy for even the simplest of chores. When even the simplest of tasks demand an inordinate amount of energy, it's easy to feel empty and exhausted. The energy that once propelled their days has been replaced with a constant tiredness, draining the fun out of life and making even the most routine tasks seem insurmountable. Arthritis has far-reaching consequences, affecting not just daily activities but also leisure time and interpersonal relationships. As a result, individuals are constantly challenged to rethink their strengths and weaknesses and develop new strategies for overcoming obstacles. Arthritis sufferers can learn to master their disease by actively searching out new treatments and adjusting their daily routines to maximize their health. In spite of the hardships they endure, they can achieve happiness and contentment via the help of the encouragement of friends, family, and medical professionals. Pain management methods. Medication and non-pharmacological treatments are used together in arthritic pain management to reduce symptoms and boost quality of life. Medications that lessen inflammation and pain are a typical choice. Arthritis pain can be alleviated by using non-steroidal anti-inflammatory medicines, NSAIDs, like ibuprofen or naproxen, which work by decreasing inflammation. Although these drugs have the potential to be helpful, there are certain side effects that may develop with prolonged use. Disease-modifying anti-rheumatic medications, DMARDs, are sometimes provided to patients with advanced stages of arthritis in order to halt the disease's progression and alleviate associated pain. The immune system is suppressed and inflammation is reduced by these drugs. Successful pain management in rheumatoid arthritis has been linked to the use of biologic response modifiers, a class of DMARDs that targets particular molecules implicated in inflammation. Arthritis pain management relies heavily on non-pharmacological strategies. Regular exercise and stretching are the cornerstones of physical therapy, which is often prescribed for its ability to strengthen the muscles around the joints, increase mobility, and lessen discomfort. Heat and cold therapy, ultrasound, and electrical stimulation are also included in this category of techniques. Arthritis sufferers can benefit from occupational therapy because the techniques they learn can help them do daily tasks with less strain on their joints. Supportive equipment such as braces, splints, or walkers may be suggested to help stabilize the afflicted joints and lessen the associated pain. Arthritis sufferers who also struggle with obesity should make every effort to control their weight. Keeping to a healthy weight can help lessen discomfort and even decrease the progression of the condition. Low-impact workouts, such as swimming and cycling, can help increase mobility, strengthen muscles, and lessen discomfort in the joints. Heat and cold therapy are two other non-pharmaceutical methods. Muscle relaxation and pain relief can be achieved by applying heat to the affected joints, while inflammation can be reduced and pain numbed with cold therapy. Warm baths, showers, or hot baths can all be utilized for this purpose. Individuals with arthritis may find relief from their symptoms through the use of cognitive behavioral therapy, CBT, which aims to alter dysfunctional patterns of thought and behavior that perpetuate pain. Positive attitudes and effective coping mechanisms towards pain are fostered through CBT's instruction in relaxation and cognitive restructuring. Low-voltage electrical currents are used in the non-invasive procedure known as transcutaneous electrical nerve stimulation, TENS, to alleviate pain. It's able to block pain impulses before they reach the brain by activating the nerves. Mindfulness, meditation, and relaxation techniques. Arthritis sufferers can benefit greatly from the stress-reducing and mood-boosting effects of mindfulness, meditation, and other relaxation practices. Meditation, mindfulness, and other similar practices help people calm their racing minds, ease physical pain, and develop a more positive attitude towards their bodies. Arthritis sufferers can take charge of their condition and enhance their quality of life by incorporating mindfulness into their everyday routines. The practice of mindfulness entails paying undivided attention in the here and now, without judgment. Arthritis sufferers may find this practice especially helpful because it teaches them to pay closer attention to their bodies and respond more appropriately to their symptoms. Mindfulness and meditation entails calming the mind to the point of complete relaxation. Arthritis sufferers can utilize meditation to alleviate discomfort, lower inflammation, and speed recovery. Regular meditation helps people with arthritis calm their racing minds and disengage from the physical pain they experience. Arthritis sufferers can benefit substantially from stress reduction and enhanced health by practicing relaxation techniques like deep breathing exercises and progressive muscle relaxation. By focusing on taking long, steady breaths or deep breaths, you can relieve stress and calm your body. The increased oxygen supply to the joints, a side effect of this procedure, may help reduce inflammation and improve joint health. Through a series of deliberate contractions and releases, practitioners of progressive muscle relaxation are able to reduce stress and anxiety in their bodies. Arthritis sufferers might find physical relief and a sensation of looseness in their bodies by gradually relaxing each muscle. As a result of the correlation between relaxation and enhanced rest and recuperation, this method may be especially useful for pain management and the improvement of sleep quality. Consistency and practice are necessary for incorporating mindfulness, meditation, and relaxation practices into daily life. Patients can ease into treatment with shorter sessions and work up to longer ones as they feel ready. You can get a lot of help and instruction with these practices through group sessions or guided meditation practices. Meditation can assist those with arthritis develop resilience to deal with the psychological effects of their condition. The ups and downs of dealing with arthritis can be less of a challenge for those who meditate on a regular basis and create a sense of inner strength. Patients can gain emotional stability through the practice of meditation by learning to disengage from their negative thoughts and feelings. Chapter 6. Arthritis and Mental Health. Arthritis can cause a lot of physical discomfort and limitations, but it can also cause a lot of mental health problems. Depression and anxiety can be particularly challenging to deal with because of the chronic pain, joint stiffness, and decreased mobility that often accompany these conditions. Arthritis can make a person feel helpless and frustrated because it limits their ability to participate in the things they once found rewarding. A lowered sense of self-worth and confidence may result from the weariness and depression brought on by the chronic pain. The need to rely on others or make significant lifestyle changes to accommodate a medical condition can be emotionally taxing on the patient. The emotional difficulties caused by arthritis are compounded by the fact that attacks can happen at any time. Living in continual fear of the next attack of severe pain or stiffness can be extremely stressful. Stress and anxiety might increase as a result of worrying about things that may or may not happen. Arthritis can cause feelings of anxiety and loneliness, which can be made worse by the fear of being a burden on others or having to cancel plans because of symptoms. Depression and anxiety are common reactions to living with a chronic condition like arthritis. Because of the chronic nature of the disorder, those who are affected may need to manage their pain constantly, may become disabled, and may require continuing medical care. Depression and pessimism might set in as they try to imagine a life free of the restrictions caused by arthritis. They may feel a loss of identity and a sense of sorrow for the life they once had as a result of the physical constraints imposed by the disease. Depression and anxiety can have an indirect effect on the quality of life by exacerbating the physical manifestations of arthritis. Pain sensitivity and inflammation are both amplified by stress and depression, making it that much harder to deal with the underlying physical symptoms. This makes it difficult to escape the cycle of negativity, since emotional discomfort exacerbates physical symptoms that in turn feed back into negative feelings. Arthritis patients require holistic care that attends to their physiological and psychological needs. The emotional burden of arthritis can be lessened by maintaining a regular exercise routine, engaging in hobbies or activities that bring joy, and surrounding oneself with supportive friends and family. Despite the difficulties provided by arthritis, a more balanced and satisfying life can be pursued by attending to both the physical and emotional components of the condition. Arthritis can hinder a person's social life, attendance at events, and capacity to maintain relationships due to the chronic pain and physical limits it imposes. Individuals may experience loneliness as a result of this separation from their social networks. Arthritis can affect not only the person who has it, but also their loved ones emotionally. The stress, frustration, and helplessness felt by family members who watch their loved ones suffer and try to help can be overwhelming. Because of this, there may be a nuanced interplay between the emotional needs of the person with arthritis and those of their loved ones. The emotional toll of arthritis is exacerbated by common myths. Because of the common misconception that arthritis exclusively affects the elderly, younger people who suffer from it often feel misunderstood and invalidated. Due to the intangible nature of the ailment, the suffering and limitations may be dismissed or disregarded, compounding the sufferer's sense of helplessness and alienation. Managing the stress that comes with arthritis. Being a woman living with arthritis has its own set of physical and mental challenges. The emotional toll of dealing with pain and constant tiredness is real. However, you can apply a number of methods to manage these challenges and have an optimistic outlook on life. Feelings of depression, anger, or even grief are normal responses to the daily struggles of living with a chronic condition like arthritis. Let yourself feel what you're feeling without condemnation. Accept that you will have unpleasant days and give yourself time to deal with them. Having a solid network of people behind you is also crucial. Get in touch with sympathetic people, such as family members, close friends, or support groups. Talking to people who understand what you're going through can do wonders for your mental health. Taking time for yourself and doing things that make you happy can have a major effect on your mental health. Schedule time for things that make you happy, whether that's a favorite pastime, a good book, some music, or some deep breathing and meditation. Emotional well-being can benefit from a healthy lifestyle as well. Pain can be reduced, flexibility can be increased, and mental well-being can be improved via regular exercise that takes into account individual strengths and weaknesses. If you need help creating an activity plan, talk to your doctor or a physical therapist. Emotional well-being can be bolstered by maintaining a healthy lifestyle, including eating well and getting plenty of sleep. Keeping a positive outlook and engaging in mindful meditation can help you take your mind off of your suffering. Attention, non-judgmental acceptance, and appreciation are the cornerstones of mindfulness. Deep breathing exercises and body scans are only two examples of mindfulness practices that can be incorporated into everyday life. Negative ideas should be questioned and reframed using positive affirmations. When it comes to dealing with the emotional challenges of arthritis, knowledge is power. Learn as much as you can about your illness, possible treatments, and ways to manage your symptoms. Anxiety and dread about arthritis can be lessened by education on the ailment and its effects, as well as through the acquisition of practical skills for managing the condition. Learn about the most recent studies, tools, and support systems that can ease your way forward. The value of social supports. People living with arthritis greatly benefit from the emotional, physical, and social support they receive from their support networks. Family members provide unconditional love, understanding, and compassion and are the backbone of these support systems. Women can find support from their loved ones, including their spouses, parents, siblings, and children. Knowing they are not on this path alone can be comforting and reassuring. When women have close female friends, they have someone who will listen to them and care for them without passing judgment. Friends that are always there for you, even if they don't fully comprehend the physical limits and discomfort associated with arthritis, are invaluable in helping you feel less alone and more a part of a community. Women can find peace in the company of those who truly understand their experiences of hardship. Women who attend support groups for persons with arthritis report feeling more confident after hearing the stories, perspectives of other women who have lived with the condition. Women might learn to better manage their illness and find hope in shared accomplishments by interacting with others who share their experiences. Women with arthritis may feel isolated because the disease makes it difficult for them to engage in social activities. Women face unique challenges when attempting to maintain social relationships. Nevertheless, with the help of family, friends, and support groups, they can succeed. Women are more likely to feel included and valued if they have opportunities to spend time and energy doing something they enjoy with other women. Arthritis can cause a person to feel alone, but the social connections within these networks can help overcome that. Therapy and arthritis. Counseling can aid women with arthritis in learning healthy ways to deal with and control their symptoms. A counselor or therapist can help you recognize unhelpful ways of thinking and help you replace them with more constructive ones. Women with arthritis can improve their mental health and lessen the severity of its effects by expanding their coping strategies. In addition to reducing pain and improving quality of life, therapists can help by introducing relaxation techniques, mindfulness exercises, and stress management tactics. Chronic pain and arthritis sufferers can benefit from participating in a group therapy program or joining a support group. By encouraging members to validate one another and empathize with one another, these group activities provide participants with a priceless source of mutual support and friendship. A person's values, strengths, and objectives can be better understood with the help of a therapist or counselor. This introspection has the potential to boost one's sense of self-worth, enthusiasm, and drive. Women can improve their well-being and quality of life by taking steps towards objectives that are realistic given their current circumstances. Therapy can greatly improve the emotional well-being and resilience of women dealing with arthritis by encouraging self-compassion, the development of appropriate coping mechanisms, the provision of a supportive community, and the promotion of personal growth. Chapter 7. Treating arthritis during and after pregnancy. Women with arthritis should talk to their doctor before and during pregnancy. High-risk pregnancies often necessitate the involvement of a rheumatologist or an obstetrician who specializes in such cases. Some women report temporary alleviation from arthritis symptoms during pregnancy due to hormonal changes. Others, however, may see a worsening of their symptoms. It is crucial to keep a close eye on symptoms and let the doctor know if there has been any change. To ensure the health of the woman and her developing child, they can work together to make any necessary adjustments to her medication, exercise regimen, or other therapies. Treatment of arthritis during pregnancy and the postpartum period requires careful attention to medication control. It's possible that certain arthritis drugs are unsafe for use during pregnancy and nursing. The risks and advantages of continuing or changing drugs will be evaluated on an individual basis by healthcare providers. Physical therapy, heat/cold therapy, and splints are all examples of non-pharmacological methods that may be advised in place of traditional drugs. Physical activity is an important tool for the management of arthritic symptoms during and after pregnancy. Joint flexibility, muscle strength, and pain relief can all be maintained with low-impact workouts like swimming, prenatal yoga, or gentle stretching. If a woman wants to start an exercise regimen during pregnancy, she should talk to her doctor or a physical therapist. Fruits, vegetables, whole grains, and omega-3 fatty acids are all great examples of anti-inflammatory foods that can contribute to your health as a pregnant woman. Joint pain can be alleviated through a combination of rest, stress management, and the use of adaptive or assistive technologies. Arthritis treatment after childbirth focuses on helping new mothers ease back into their routines. Lifting and caring for the infant may put extra strain on the body, so they should be cautious of their joint health. Joint tension can be minimized by using ergonomic baby gear, enlisting the aid of partners or family members, and employing correct body mechanics. Strength and mobility can be better regained with the help of postpartum exercise programs like postnatal yoga or physical therapy. It's also important to take care of yourself emotionally and physically. Managing arthritis throughout pregnancy and the postpartum period may already be difficult due to the spectrum of emotions that women experience during these times. Participating in activities that encourage relaxation and mental well-being and reaching out for assistance from loved ones or community groups can all help with arthritis management and general health. Controlling one's weight is essential for the treatment and prevention of arthritis during and after pregnancy. Joint pain from arthritis might be made worse by carrying around extra pounds. Doctors and other medical professionals can advise patients on how to eat healthily and stay active. Stress on the joints can be reduced by using joint protection measures. Some examples of such measures are the use of braces or splints, the maintenance of correct posture, and the avoidance of actions or stances that place unnecessary stress on the joints. Some women with arthritis may get comfort from alternative therapies like acupuncture or massage. A skilled practitioner familiar with working with pregnant and postpartum women should be consulted to assure safety. Arthritis in the hands or wrists can make breastfeeding difficult for women. Medical professionals can advise on optimal breastfeeding positions and helpful nursing aids to ease discomfort. Hormonal shifts after childbirth may have an impact on arthritis symptoms. In the months after giving birth, some women may notice a worsening of their symptoms. It is crucial to keep in close contact with one's healthcare professionals in order to appropriately manage these changes. Arthritis can have an effect on one's emotional well-being. Therefore, taking care of one's mental health is crucial during this time. Talking to a therapist or counselor who has experience working with people dealing with chronic disease or postpartum mental health issues might be helpful. In order to ensure the best possible outcomes for both mother and child, it is essential that women with arthritis throughout pregnancy and the postpartum period engage together with their healthcare professionals to build a personalized management strategy. How arthritis affects women's ability to work. Women with arthritis are more likely to suffer from chronic pain, which can have a substantial impact on their ability to work. Arthritis pain can be so painful that it prevents women from participating in activities that call for prolonged sitting, standing, or physical activity. As a result, women may have trouble carrying out their work responsibilities, especially those that call for manual labor or involve repetitive motions. Constant pain can cause exhaustion, which in turn lowers productivity and efficiency on the job. Arthritis also causes a loss of flexibility and movement. It can be especially difficult for women to go about their job if they have mobility issues. Jobs that require physical mobility or frequent travel may be out of reach due to this handicap. In addition, the limited motion may prevent women from achieving their full professional potential or advancing in their chosen field. It can be taxing on the psyche to deal with the ongoing suffering caused by this ailment. Stress, anxiety, and depression are more common among women, which can have a negative impact on their ability to think clearly and concentrate. It may be difficult for them to retain the same level of productivity and interest in their work if they experience a decline in job satisfaction and motivation due to these psychological issues. The unpredictability of arthritis can add another layer of difficulty to a woman's professional life. Work plans might be thrown off by flare-ups and unpredictable symptoms, leading to missed days or a decreased capacity to fulfill deadlines. This instability might make it difficult to settle into a regular work pattern, network effectively with coworkers, and keep one's employment. The social stigma and common misunderstandings about arthritis are other important factors to think about. A lack of empathy or job concessions may result from some employers' and coworkers' inability to grasp the full scope of the condition. As a result, women who suffer from arthritis may find it more difficult to advance in their careers due to a hostile work environment. Women may be less likely to come forward about their illness if they think they will be treated differently or judged negatively for doing so. There is no denying the cumulative impact arthritis has on a woman's ability to work and advance in her profession. Career advancement, job availability, and general job happiness can all be hampered by the condition's physical and mental restrictions. Arthritis and relationships. Arthritis can have a number of effects on closeness in a couple's relationship. Arthritic women may find it difficult to engage in particular activities or positions during intimate moments due to the physical pain and stiffness connected with the condition. Both parties may experience negative emotions such as anger, despair, and guilt as a result. Arthritis-related weariness and lower energy levels can also impair sexual desire, which can have a negative impact on intimacy in a relationship. Maintaining closeness and connection in the face of these obstacles calls for open dialogue, patience, and understanding. Family relationships are also impacted by arthritis because of the need to modify regular activities and duties. Arthritis in women can make it difficult for them to take care of their homes and families, especially younger children and elderly relatives. Some women have feelings of guilt or inadequacy as a result of this shift in roles and duties because they believe they are not living up to societal expectations or making sufficient contributions to the family unit. On the other hand, loved ones may face stress and bewilderment as they try to adjust to the new circumstances and offer assistance. Fostering an environment of understanding, compassion, and patience amongst family members is crucial in such circumstances. Recognizing and accepting the difficulties experienced by women with arthritis is the first step towards reorganizing household duties. To ensure that everyone's needs are addressed and the family unit is maintained, it may be important to seek external aid, such as employing a carer or involving extended family. Open and honest communication between the person with arthritis and their loved ones is essential for navigating these emotional problems. Communicating feelings, worries, and anger can improve mutual understanding and empathy. Arthritis can have a number of different effects on physical and emotional intimacy. Some sexual positions or activities may become unpleasant or difficult due to physical pain, stiffness, or tiredness. Frustration, less frequent sexual experiences, and stress on the couple's romantic bond may result. Intimacy, however, includes more than just physical contact between partners. It is still possible to prioritize and cultivate emotional intimacy in the relationship through means such as honest communication, tenderness, and non-sexual physical contact. It takes a combination of patience, open communication, empathy, and mutual support to navigate the complexity of arthritis within relationships, intimacy, and family dynamics. Women with arthritis can find methods to keep their relationships strong and rewarding by being supportive, getting help from professionals when they need it, and being flexible. Chapter 8: Arthritis and Dieting. In order to better manage this condition, it's crucial to eat a wide range of fruits and vegetables. Antioxidants, vitamins, and minerals found in these healthful meals all work together to lessen inflammation and strengthen the immune system. Particularly useful are cruciferous veggies like broccoli and cauliflower, as well as berries, citrus fruits, and leafy greens. Omega-3 fatty acids are a crucial part of a healthy diet. Fatty fish like salmon, mackerel, and sardines, as well as walnuts, flax seeds, and chia seeds, are excellent sources of these healthful fats. Since omega-3s have been found to reduce inflammation, they may be useful in treating arthritis. The protein important as well. Selecting lean protein sources including poultry, fish, lentils, and tofu can help with tissue maintenance and repair. Protein helps build muscle, which is important for people with arthritis because it reduces the strain on their joints. Refined grains are not as healthy as whole grains. Whole grain foods like bread, rice, and quinoa have been shown to help with both weight control and keeping blood sugar levels steady because of their high fiber content. Joint pain and inflammation caused by arthritis might be exacerbated by being overweight. Arthritis can cause bone density loss, so getting enough calcium and vitamin D is essential. To get enough calcium in the diet, you can consume dairy products, fortified plant-based milk, leafy greens, and foods like almonds and sesame seeds. Vitamin D supplements or adequate sun exposure are also recommended. It's crucial to watch what you eat and stay at a healthy weight. Arthritis discomfort is made worse by extra weight because of the added strain on the joints. A healthy diet that matches energy expenditure can help with weight control and ease the stress on your joints. Keeping yourself hydrated is also important for the health of your joints and body as a whole. It is recommended that you drink plenty of water and limit your intake of sugary drinks. Reduce your intake of processed foods, added sugars, and saturated fats because these all contribute to inflammation and weight gain. Foods may also be a trigger for arthritic symptoms for certain people. Keeping a food diary might be helpful for people who suspect they may have food sensitivities or allergies. Women with arthritis should get enough of sleep to help their bodies heal and repair damage. Inflammation, pain, and overall wellness can all benefit from a good night's sleep. Stress management is also crucial. Arthritis sufferers may find that prolonged stress exacerbates their condition. It's important for women with arthritis to be vigilant about their medication administration. It's important to talk to your doctor about any dietary restrictions or changes you might need to make while taking arthritis medication. Constantly keeping tabs on your arthritis symptoms and communicating closely with your doctor is essential. Working together with medical professionals helps people with arthritis make dietary and nutritional decisions that are tailored to their unique requirements and preferences. Keep in mind that people with arthritis may have different nutritional requirements. Dietary decisions should be made with care for individual tastes, medical history, and other health issues.